Hello, my name is Marty Pagel, and I would like to present Replace, a new model for clinical radiology. This presentation is derived from an excellent publication by Richard Levinson and his colleagues published in PLOS 1 in 2015, and I would like to refer you to that publication for more detail. So there really is a need for more imaging features in diagnostic imaging of cancer. And here is a case with information-rich images. These are pathology images of cancer specimens, tissues extracted from patients and placed on microscope slides, and then stained with a rather standard H&E staining method. You can see they're colorful. They have a lot of detail within these images, especially at high magnification. And so those who are trained can identify a set of images as being from benign cancer versus malignant cancer. So if we were to take four untrained observers and start to train them, well, after a relatively fast period of time, they can identify which slides, which images are from benign cancer and which are from malignant breast cancer, especially at the high magnification where there is more information. The 4x magnification has less information, and so it does take longer for the observers to be trained, but they do reach a pretty good level of getting the percent correct diagnosis of benign versus malignant. So how does this training work? Well, they have a very large training data set that they first observe, and then they are presented with a completely new set of images. And if they've learned those features from the training data set, then they get the test data set right as well. And you can see with a lot of information, the training works, and new images can be diagnosed as being benign or malignant. Interestingly, one observer doesn't always get the answer right, but by combining the information in something called a flock source model, four observers can get the answer right quite well. In fact, they can diagnose with outstanding sensitivity, which is a measure of how well you can identify a suspicious lesion versus normal tissue. And they also identify or diagnose images with outstanding specificity. They can identify images that are specifically from malignant tumors versus benign tumors. So for comparison, if the observers were presented images from mammography, basically X-ray or CT imaging of patients who have clinical breast cancer, you can see that these images are not information rich. They're grayscale images, not colorful. They're somewhat wispy, and they do not have the magnification that you get from microscopy from pathology. And so with these information poor images, it takes longer for the observers to be trained. And also the observers really don't get to a high percent correct or as high as the information rich images. So importantly, even after training, and these are four separate observers, one of the observers just never really got a great training or never learned the features within the images through training. After then looking at the training data set, if they start to look at new images, they basically fail. It's basically a coin flip, 50% correct, 50% wrong, and looking at new images and identifying whether they have the features that would be from benign or malignant lesions. So information poor images will lead to poor training. That leads to these conclusions that more imaging features lead to shorter training times, improved learning, improved sensitivity and specificity, and of course, four observers will be better than one. So there is an important point to be made on this slide. Those of us who do molecular imaging research need to somehow cause these information poor images to become information rich, which will then help the observers with their training time and then also to get the answer right, to get outstanding sensitivity and specificity in their diagnoses of cancer. So that's my job as a molecular imaging researcher, to add more information to these images to make them information rich. But here's the key. In the study performed by Dr. Levinson and his colleagues, the observers were not trained clinical radiologists or pathologists. They were not even humans. The observers were pigeons. So these researchers constructed a box and placed a pigeon within the box. Pigeons have outstanding eyesight, and that's why they were chosen for this study. And if the pigeon were to look at an image, The pigeon would then peck on the left side of the box on the blue strip or on the right side of the box on the yellow strip. And if they chose correctly, they would be rewarded with a pellet of food. And after a while, the pigeons learned that there were certain features in this image. They had no idea it was from breast cancer. It was just an abstract image to them that had a certain type of pattern that they could pick up with their eyes. And if they saw that pattern, and if they then pecked on the correct side of the image, they would get rewarded. So they had a reward mechanism of food. And of course, our clinical radiologists do something similar by observing images and then selecting whether they are benign or malignant. And of course, they have a different reward mechanism than just pellets of food. But if we can make images information rich, as my job as a molecular imaging researcher, I would like to propose a new program. I'd like to propose the REPLACE program, which stands for Radiologist Equivalent Pigeons for Low-Cost Accurate Cancer Evaluations. So the REPLACE program would use the Texas Pioneer pigeon. I'm at the MD Anderson Cancer Center in Houston, Texas, and so we would like to use a Texas bird. I think it's a rather handsome looking pigeon. It is pricey, but here at the MD Anderson Cancer Center, we spare no expense for our cancer care. I estimate it would take 5 pounds of dry food per year per pigeon, and 4 pigeons could be housed for the cost of $1,000 per year. And because the pigeons have about a 15-year lifespan, we can replace 130 radiologists at MD Anderson for 15 years, saving $840 million. Quite a savings to our patients. So with that, I'd like to thank Dr. Levinson and his colleagues for this interesting research study that was published in PLOS One in 2015. And again, I would like to refer you to that study if you have more questions. And of course, I would like to thank the members of my research group here at the MD Anderson Cancer Center who put up with a lot of my crazy ideas. Thank you.